to the world. Subscribe now to the Hot 97 YouTube channel. It's Ebro in the Morning with Laura Stiles and Rosenberg.
Eric, what's up?
How's it going? Good to see you. Good to see you all.
What's going on, man?
One day at a time.
That's it, man. Riding out the storm.
What's going on, bro?
Have you been doing the show remotely?
Some of us. I'm in the studio. Shawnee's in the studio. And then Laura Rosenberg, Juanito Cass, they're at home. So we reduced the number of people in the room. And then around the hallways, there's nobody else really here. How many people over there? BLS? 3? Yeah, 3. And then they work in separate rooms. So we got 3 at Hot and 3 at BLS. And then throughout the rest of the day, it's just one person per thing.
Got it.
How are you?
Good, busy. You know, it's been nonstop.
Yo, sorry, we had a full panel the other day, and it was hard to manage even the people they had confirmed for our town hall, but we're gonna be doing another one.
Good. I think it's important. There's a lot of pieces coming out of this. You know what's happening with COVID-19. So I think it's important to do exactly what you're doing, so people can get real information on the ground. Yeah,
we it's one of the things I find very difficult in speaking to politicians is, a lot of what we're dealing with comes down to money. Mm-hmm. And, having conversation about why city hospitals funding, why testing in our neighborhoods is slow or non-existent, why we have to, obviously food deserts and everything that we already been dealing with. That's already been in our neighborhoods, nutrition, education, all of these issues. Now you have this pandemic, and finding the answers is still difficult.
Yeah, it's a combination of things. One thing's for sure, that the crisis is not just coronavirus. It really amplifies the pre-existing dysfunctionality that it has existed. So that's all you're seeing. You're seeing those historical problems were already in place, and then you have a crisis like this. That's right. It just amplifies that, hey, here's the problem that we had in place for a long time. And last time I did your show, this is what I was talking about, that, our cities are dysfunctional across this entire country.
That's right.
We got to deal with it.
Now, we're talking to Eric Adams. He's the Brooklyn Borough President. You got Rosenberg, you got Laura Stiles. We just kind of dove right in. We had a town hall, what was it, 2 weeks ago now, guys?
Last week.
That was last week.
Yeah,
and now we wanted to take some time to speak to the Brooklyn Borough President, who's been very vocal, not only about, making sure that, neighborhoods in Brooklyn, but all across the city where people who look like us live get testing, but also directly addressing the NYPD. We spoke to Chief Madry the other day. And directly asked him about the videos that we're seeing where it seems like black folks are being policed. I mean, black folks in our neighborhoods, especially teenagers, are policed way more aggressively than any other group, and black men specifically, than any other group in the city. Now you have this social distancing orders and this pandemic, and we're seeing videos where it appears that police are being more aggressive and not equally and evenly distributing how they're managing social distancing across the city. What would you like to say?
Well, first of all, Chief Madry is a good brother. He's a solid brother in what's called Brooklyn North. That is, really the predominant black parts of the borough. And he's really innovative in how he police. But if we go back to the beginning of this virus, just think about this for a moment. What the hell is social distancing? We sit in our dinner parties and our halls of academia and create these terminologies that they do not translate on the ground. And when this started, I said that we're talking in the echo chamber. Everybody doesn't get up in the morning and read the New York Times, listen to Trump, de Blasio, and Cuomo communicate. People talk and communicate in different ways. They should have reached out to shows like this and various ethnic medias and just kept it plain and kept it simple. That listen, folks got to stay 6 feet away from each other. At the start of this, I remember pulling up at a park in Canarsie. 2 brothers were playing ball, and I said, "Listen, brothers, you got a social distance." They said, "Borough President, what the hell is that?" And so if you start off not communicating in a diversity of methods of communication, you're going to end up screwed up. And you see the implementation of this program wrong. The police needs to get out of this. This is not a public safety issue. This is a public health issue. The police should be just handing out masks, trying to build good relationships, allow the existing credible messengers to get the message out.
Now, Marjorie says that they are handing out masks. I will say that de Blasio came on our show a couple of times, right, guys?
Yeah.
In the beginning of this. I mean, obviously, we've been talking about 6 feet apart, and we've, also been using the word social distancing. I do believe that, there was an air amongst even us that didn't take this in the beginning as serious as it needed to be. Just because probably ignorance, 1, and 2, we'd never been through anything like this before. So really, how bad was it going to be?
Well, I take a different view of that. When COVID-19 hit the ground in America, there was some information that the leaders were well aware of.
Yep.
We knew it. Regardless of what the everyday New Yorker was aware of, there was information that the leaders were aware of. And the first thing we did, as soon as it happened, I told my staff, this is a problem. We divided the country and city into essential and non-essential employees. We told the non-essential employees, you have to shelter in place, you have to stay 6 feet from each other, you have to wear face covering. The essential employees, we told them that by the nature of your job, you can't shelter in place, you can't stay apart from each other, and we're not giving you any face coverings, and if you try to wear it, we're going to penalize you. Over 75% of the essential employees were Black and brown. They were not allowed to get tested. If they were not admitted to the hospital, they sent them back home. They infected their family members in the process, and we did not give them the resources they need. I'm not only talking about doctors and nurses or nurse staff and hospital staff that are
NYPD, all of that.
All of the grocery store clerks.
Yeah.
And so we said to the Black and brown people and the immigrants of this city, you're going to put broccoli on our shelves in the supermarkets. You're going to drive our trains. You're going to be inside our schools to hand out food. And we're not going to give you the resources you need to protect yourself. That is not only what happened in New York, brother. It happened all across the country. That's why we filed that letter to the U.S. Justice Department. This was the greatest experiment on Black people since the Tuskegee experiment. And we got to be honest about what happened in this country to Black and brown people.
Now, do you think it was that sinister, where it was an experiment, or do you think it's such the way our society is set up that those are the jobs that we have. We occupy that space in the United States because of structural racism and generations of oppression in this country, where Black and brown people occupy these working spaces because of limitations in education and social upward mobility.
Well, you don't say one group of citizens are more important than another group of citizens. And if you're going to put your frontline workers on the front line, you make sure they have the equipment to do the job and to protect them in the right way. We knew that those with pre-existing medical condition were more likely to be hospitalized and die. That's NYCHA. That's a description of NYCHA. Pre-existing condition is asthma, diabetes, high blood pressure. There was no plan for our senior centers where many of our grandmothers are inside. This is what happened. The city and state and country, they were too busy worrying about what could have happened that they didn't acknowledge what was happening, because what was happening to Black and brown people. We put a group of people in the country in a safe location, and we put another group in harm's way. You can't do that to your citizens. We're all in this together. And what troubles me, and what happened during stop and frisk era, when I fought against that is that too many good people in the city knew that 1 million black and brown boys was being stopped and frisked, but they say crime is high, so we got to look the other way. That's what happened here. We knew COVID was harming and even killing people who were essential employees, black and brown, but we said, listen, we're afraid of this disease, so we have to do what we want to do. Everyone who was shelter in place should have been raising their voices saying, give these people the tools that are running this city, and they did not do that.
And you feel, and now is that a indictment on Mayor De Blasio? Is that Cuomo? Or is that the federal government?
Everybody.
Who had the resources? Is that everybody? Who had the resources? Because I remember people talking about running out of equipment, like it didn't exist. It wasn't made.
That is the most powerful part about this. Go back 5 weeks ago, and I have been saying this from the beginning. There is no shortage. You know, Stephon Marbury wanted to send 10 million pieces of PPE a week here to the city. We just learned today that the Department of Health and Mental Hygiene had a stockpile of PPEs in their warehouse in New Jersey. The MTA, while MTA employees were dying, and I was handing out masks to them from the donations I got from China, the MTA had a stockpile of PPEs in their warehouse. They just acknowledged that they didn't give them out to them. So it wasn't that there was a shortage that everybody was talking about. That's why this investigation is important, the civil rights investigation, where we can go in and find out exactly what happened that people didn't get those PPEs. I got PPEs. Hospitals called me. I was giving out thousands of PPEs that were donated from China, came through DHL, the same form of transportation. Warren Buffett flies a plane over to China and picks up a plane full of PPEs for an affluent hospital in Manhattan. But we can't get them here on the ground in our Health and Hospital Corporation. That's not acceptable. The richest country in the richest city, and we can't get personal protection equipment. I can't buy that.
You've been on the front lines here in New York City for 30 years?
Yes.
At 30 years, you were a police officer, right?
Yes, I was. Retired captain.
Forever. Lincoln Hospital in the Bronx, Harlem Hospital, Elmhurst, the city-run hospitals have had a shortage of resources, correct?
Yes, sir.
Now we have a pandemic that exacerbates an already existing issue.
Yes.
How is it that the wealthy folks, a lot of them, go to private hospitals, but the money still doesn't flow into the city-run institutions? Explain to me why that dysfunction exists and how it can be fixed.
It can't be a coincidence. You when you look at there's something called reimbursement rates. You know, this is what the government pays back after a hospital gives cares. Our hospitals are called safety net hospitals. Those helping hospitals that you had, the Kings Counties of the universe, you know, the Lincolns of the universe. Those are our safety nets. So if you don't have the money, the affluent money to pay for healthcare, you will always get the healthcare in these hospitals. The reimbursement rates are higher in Manhattan. Think about when COVID-19 happened. What did we do? We took the Navy ship. Where did we put it? Where did we place it? We placed it in Manhattan. We opened an emergency hospital. Where did we open it? Jacoby Hospital. Over on the west side at Javits Center in Manhattan. Brooklyn and Queens had the largest numbers of deaths, largest number of cases. We were the center of the epicenter. We didn't get a testing location until 4 weeks after Staten Island on the South Shore got a testing location, a drive-through testing location. We have two different healthcare systems in the country and in New York. One is for the affluent and rich, and another is for the poor.
Who manages that? Well, give me a name. Who manages that?
How could that be decided if Manhattan's been the lowest of all the boroughs in terms of effect from COVID-19 since the very beginning?
Exactly. And when you do an analysis, and this is what we were saying from the beginning, I had a call with all of my doctors week 2 into COVID-19. What happened in week 2, the Department of Health was determining who would get tested or not. It's so important. And week 2, I called all of my hospital presidents in Brooklyn, and I said, what's going on with my test? They said, Eric, for every person who have the symptoms of COVID-19, we have to go to the Department of Health and get a request for testing. The Department of Health, they said for every 10 requests we made, they were only approving 1. So we were sending 9 more people back into the community. So why were all these other folks able to get tested all over the country when we weren't able to get tested in the area where it was ground zero?
But Eric, what was the reason for that? Like, why would people who are sick not get approved?
Sister, that's what we were fighting for. And it was a voice. This is very interesting what happened in this city. And I saw this so many times as a police officer. When crises happen, all of the rules and the beauty of being Americans, all that mess goes out the window. Hey, it's about, listen, we're going to take our resources and we're going to funnel those resources into communities we believe are important, and we're going to ignore those communities that we don't. That's why when I reached out years ago, I established sister city agreements with China, and I reached out to those sister cities I have in China and said, listen, I need masks. That's why I was in NYCHA handing out masks, because I knew no one was coming to NYCHA to hand out masks. That's why I was giving them to the transit operators. I was going to give it to school crossing guards and school safety agents. They were ignoring our folks on the ground. And I slept for 45 days in this office. I have not left this office. I don't even know what my mattress looks like anymore at home, because I knew if I didn't get on the ground and give services to our people, they would not have gotten those services. They were ignored. And now we're starting to say, as an afterthought, okay, now let's go deal with the issues of food to our seniors. Let's go deal with the issues of giving the services to our seniors.
Now, once again, who is this? Is this the mayor? Is this city council? Like, who oversees? Is this the Dr. Barbeau lady we had on the? Who is it?
Combination. Federal government screwed up. Donald Trump screwed up. The downstate hospital, center of this virus, downstate had money to buy a machine called the Roach machine. It allowed you to do 1,000 tests a day. They had the money. The factory wanted to sell it to them. Donald Trump said, no, we're not allowing you to sell the machine to downstate. And they did it to other hospitals across the country. They stopped some of our supplies from coming here. Our state government messed up. They did not have a plan. We were supposed to fight this on 2 levels, Ebro. We were supposed to fight it on intervention and prevention. We had an intervention plan is if you have it, now we're going to give you the medical services. But we're supposed to prevent people from getting it. We had a prevention plan for those who were affluent. We didn't have a prevention plan for those who were economically challenged. So the state government, the governor, and the mayor failed to put in place a prevention plan for those communities to prevent them from getting it, and they're responsible for not doing so. And we shared that with them several times. And I told them last week on the call, I said, man, we were telling you over and over again of what happened, and in my communications with the governor's office as well.
I don't see, and if I'm being completely honest, I don't see a way that America at every level would have been successful with something like this when you have leadership at the federal level that we have right now. In 2015, there's audio of Barack Obama and video of Barack Obama encouraging us to put together plans for a potential situation like this. And I think that's how he successfully thwarted with his squad the Ebola spreading and getting out of control. And there was also SARS, I believe. We did not put focus on that, and I think the end result is what we're seeing today, all the way down to the city level. Am I seeing that correct?
I was looking up. There's a powerful book I want you to get when you get a chance. I know you're a reader. It's done by Ron Emanuel. And I learned this when I was in Turkey meeting with some of the leaders of cities. Cities run the countries. National governments are dysfunctional all across the globe. But it is important for cities to get it right. Cities must build infrastructure. And Ron Emanuel talks about this in his book. If cities build the infrastructure, cities are responsible to make sure that children are educated, healthcare, our food systems are right, our streets are safe. You know, national governments, they play with moving the chess pieces around, but it's the collaboration of cities that are moving towards when the Paris Agreement is falling apart. Cities are coming together and saying, we're going to do things locally. So if you build the right infrastructure in our cities and in our states, then we can have the opportunity to turn this around no matter what the national government is doing and no matter dysfunctionality. Our systems are dysfunctional. And if we continue to have dysfunctional systems, then we're going to continue to see a dysfunctional result. Here's my perfect example. Pre-existing conditions, 90% of the people with pre-existing conditions were hospitalized. 94% that got the virus, that died from the virus, had pre-existing conditions. Pre-existing conditions means, though that's a fancy term from chronic disease, asthma, diabetes, respiratory issues such as that. We are feeding food to people that we know causes chronic diseases. Why is a city giving someone instant oatmeal spikes your diabetes? Giving them a food made out of white flour spikes your diabetes. Diabetes is the umbrella disease, #1 cause of blindness, #1 cause of non-limb amputation, one of the leading causes of kidney failure, of heart disease. So right now we should be using this moment where we're feeding people, feed them immune building food so we give them the ability to fight against the virus. But since the city is dysfunctional in their feeding process, they are causing the disease to continue to expand inside these communities.
And what's the name of the book from Ron Emanuel?
Cities, I'm gonna make sure I text it to you. It says cities, mayors runs the cities. I'll get the exact name for you, but it's this new book that came out, and it talks about the power of cities and why cities are so important. And it's a good read for everyone to go. It's called Ron Emanuel, the Nation City, Why Mayors Are Now Running the World.
Oh, Ron Emanuel from Chicago.
Yes, which is a powerful story. His dad came here at 10 years old with no money, trying to find his father, and eventually made his way, his granddad, it made his way through Chicago, and Ron Emanuel became a congressman and then eventually the mayor of Chicago. And he talks about how if cities can change the direction of the entire country, if the cities are organized. And I'm telling you, bro, I crisscross this entire country. I have not found one city that's not operating in a dysfunctional fashion. We have to stop feeding crises and start solving crises. That is where we're going wrong. But you got to be bold enough and a visionary enough to step outside of the norm and do things differently. And it starts with really dealing with how we are feeding people in these cities.
Do you feel like the NYPD is being managed effectively? Just yesterday, Commissioner Shay McDermott lashed out at the assertion that his NYPD was racist. What do you have to say to that?
I don't believe in it. I don't believe in broad brushing any institution, no matter what it is. We're catching hell in every institution. We're catching hell in, there's problems all over. So I'm not going to say every police officer that patrols these streets, every police officer is racist. What I do know is that we allow our racial overlook and view to get in the way how you properly deploy resources and how you properly police a city. I said this as a cop and 100 Blacks in Law Enforcement. I testified in the Floyd versus New York City in the suit in the federal trial. The federal judge mentioned my testimony in a decision, a ruling against the police department, where they're going wrong. Number one, they should not be in the business of enforcing social distancing, standing apart from each other. This is not a public safety issue. This is a public health issue.
But then how do you then address when you do see situations where people are not enforcing it on their own?
And I had a meeting yesterday. We had a Zoom meeting yesterday with close to 100 community and organization, credible messengers, Cure Violence, civic groups, a block association, bids. They're saying they want to help. They say, let us do this. Let us show our communities how to go about social distancing. Now, we had an incident in the subway the other day. Young ladies with her daughter or son or child.
Right, I read about this.
She wore a mask, but she wasn't wearing it right. Give her instructions. But does it escalate to the point that I'm wrestling her on the ground? No, let her go. You know what? Let her go. Hey, listen, ma'am, you got to wear your mask right. You know what? She said, screw you, I'm not wearing it right. You know what? Let her go. So what? How much are we going to win? We're gonna take her life by trying to save her life? It's not making any sense. Yes, we're going to have those people who are angry, who are pissed off, who lost their job, can't pay their rent, may have lost someone in COVID-19 that's going to say, I'm not wearing a mask. I'm mad as hell. The hell with you. You know what? Leave them alone and let them go. The overwhelming people will comply and they will take the instruction. As a cop, I knew sometimes it's not worth it.
No, picking your
I'm
battles.
not gonna let my ego get in the way. And now I'm wrestling you to the ground. I'm putting you in a chokehold. I'm trying to hold you down. Now all of a sudden you're gonna lose your life because I'm trying to save your life.
In front of your
That
kid.
little baby is traumatized. She'll never get that image out of her head. Let's not take this so much that I'm going to tell you in Brownsville, I'm gonna wrestle you to the ground, but on Chelsea Piers, you're gonna sunbathe and I'm gonna hand you a mask. Those are the images that's really destroying what we're doing.
And you feel like those, Chief Madry said the videos that we saw of people being wrestled to the ground were not related to social distancing. Do you believe that?
No, I don't. I think in some of those cases, particularly the one that we saw in Lower Manhattan, you may have some incidents where people had underlying crimes that they were doing. That you know what the police department should do? They should come out immediately and let you know, hey, this is what this arrest was about. But here's what I don't want them to do, as they did with stop and frisk. I don't want them to all of a sudden tell me someone was arrested for resisting arrest, disorderly conduct, assault on a police officer. And then when I go back and dig into it, they say, well, how did we get there? Well, we did a stop and frisk. And then all of a sudden it escalated to this. So don't say that, hey, the person was not arrested for social distancing. But when I dig into it, I find out that your initial stop was a social distancing stop. If that was your initial stop, and then it escalated to possession of marijuana, assault on a police officer, disorderly conduct, then your initial stop was a questionable stop.
You started with some bullshit.
I think there you go. Because I know that song, man. I know that song. I heard that song already. Listen, over 90% of the people that were arrested were black and brown. Over 80% of the people that
Madry said he doesn't believe those numbers.
Well, the numbers came from them. I mean, I didn't get these numbers. This wasn't my investigation. The numbers came from the police department. These are the figures that they put out. They said that over 90% of the people they arrested were black and brown. And so unless they're going to come back and give us different numbers, then we got to go with the numbers that they had. And even those numbers were tainted because we're finding out now that some of the arrests that they made due to social distancing, they did not put into the number because, like I said, they said, well, there were other crimes attached. Listen.
It's never ending, man. It's exhausting, man.
Not for me, man. I've been doing this for 30 plus years. And, as I told my team when this first happened, listen, this is what I do. This is what I do. We can turn this city around. And by turning this city around, we're going to turn this country around. And people don't think it's possible. I know it's possible. I know that if we start expecting more, if we start making a dysfunctional city function correctly, we'll change the lives of people, and we won't have everything as an emergency and as an urgency. Proper preparation prevents that. Here's the sentence that says it all, Ebros. You have to properly manage your assets and equitably distribute your resources in a real time. You can't, this is not a mom and pop shop anymore. Computer learning, artificial intelligence has changed the game of running cities. And if you are not ready to manage your assets and deploy them in real time, then you're not ready to run cities in America anymore, because America has to keep up with the globe, and the globe is not going to sit back and wait for us to move at the snail pace that we moved at. We were caught flat-footed, and we should not have been caught flat-footed. With all of this technology we have, major technology industries and company in this city, we could have ran this operation better.
Well, look, I know you're running for mayor, and one of the conversations that we had when we had our town hall, or at least something I expressed, and I felt like everybody was agreed, was that us as the people want to see elected officials admit that they dropped the ball. Because that, for me at least, gives me faith in you learning from you as the elected official, not you, Eric Adams, but you as those in charge, learn from your mistakes, and hopefully we can be greater the next time. You are running for mayor, so if you win, we will be having these conversations around your preparedness and your ability to make sure the city's functioning and not flat-footed, correct?
Yeah, without a doubt, brother. And this is so much more than a run for mayor. Let me share this. Generals don't send their troops into battle and ask, how was the war? They're on the front line. And that's how you get a real interpretation of what's happening on the front line. I knew there were not enough PPEs given to nurses because I was in a hospital giving them the PPEs. I knew our seniors didn't have food because I was knocking on their doors, delivering food to them. I knew what was happening to our essential employees in grocery stores and TA employees because I was standing next to them. You cannot expect yourself to be a general, and if you're not willing to lead your troops into battle and not follow them into battle. That's what a general does. And that is why we need leaders that are willing to roll up their sleeves, get in the grind. I'm not going to tell my essential employees, put your life on the line, but I'm afraid to put my life on the line. You got to lead from the front. That's what leadership is.
There it is. Eric Adams, thank you for your
Good
time.
stuff. Thank you,
Laura
Eric.
Rosenberg,
Thank
Shawnee,
you.
anything before we let him go?
Nah, we good.
That was great, man.
Good. That was
All right,
great.
man. We'll be talking to you again because
All right,
this
well,
thing ain't
always
over,
good
man.
seeing you guys.
Take care.
Take care.
Thank you.